joining us in person and morning, afternoon, whatever time it is for those of you joining that's online. Would someone on the back mind closing the door just because it can get loud? We learned last session. Thank you. So as we're doing introductions, if you wouldn't mind logging into the app and answering the polling questions that we will reference to at various times during our presentation, that would be helpful to sort of gauge the discussion. This is sort of designed to be more of a discussion rather than a lecture of a statute, so please participate as you feel you want to, but if you do not want to participate, we will not be calling on anybody. So introduce myself, I'm Josh Baker. I'm a clinical biochemical geneticist at Lurie Children's Hospital in Chicago.
Hi, I'm Elena-How. I have Classical PKU and I'm a doctorate nurse that works in Chicago. I'm a licensed nurse. And before we get into our agenda for today, can we make sure that people virtually can hear us? Since we don't have microphones over here. Can you guys hear us in the back of the room? Yes. Okay, great. And then in the chat, can you just let us know that you can hear us virtually? If there's anyone there. And then while people are writing that in, I would just like to know kind of who we have. Can you raise your hand if you're an adult with PKU? So a lot of people in the room. And also in chat, can you let us know if you're an adult with PKU or a supporter or family member or spouse of someone with PKU? You also raise your hand in the room. That's you. Awesome. And then any healthcare professionals? Any both, like me? Awesome. Okay, good. That just helps us get an idea of who we're talking to here. Okay, so for today, I'm going to be speaking to you guys about my journey with anxiety as a human and as someone with PKU. We'll do kind of a little bit of self-reflection here together. We'll talk about anxiety and depression during the pandemic, which is a huge topic in and of itself. We're going to talk about mood and PKU research findings, as well as coping strategies, and then building your PKU coping care plan, and just a lot of discussion amongst us. So thanks for being here today, and we'll get started.
Just to test out the chat, no one message in the chat if they could hear us or not. Can someone just say yes in the chat so that we can make sure we get your participation? Thank you, Corey. Yes,
great.
You think 2 years into the pandemic we would know how to work technology?
Okay, so the first polling question we have is, what's the biggest stressor for you? A, living with PKU. 2, work or school issues.
So do you have the app for the conference?
Yeah.
If you go to the agenda, go down to the session that you are in, and then there should be polling questions there. Yeah.
For those who don't have it's the biggest stressors, living with PKU, work or school issues with family or friends, the pandemic, and illness, the financial stress.
Right now we have 3 votes. What is the biggest winner? We can talk about mom.
So yeah, great.
What is the app?
It is. Vote so far. The second, then we'll talk. So I can read off what it's pretty split right now.
Maybe the insurance would be under finance.
Okay. I think we'll keep moving so we have time to discuss, but I think that, and then hopefully you can download the app and put the other polling questions. But for the first one, kind of interesting, it's still bouncing around a little bit. We have 11 votes, 45%, well, not 12 votes, 50% people say financial stressors are the largest. And then split 25 of work or school issues, and then issues with family and friends. 0% of pandemic or illness, and 0% living with PKU.
You wanted more, you wanted to be able to vote for more.
Yeah.
That would have ranked somewhere in there.
Yes.
Finance and PKU.
Yeah.
Yeah.
Yes. Does anyone have any other thoughts or things they want to share about that? No.
Okay, so I'll go first then. I'll share my anxiety and stress. As I said, I'm a nurse in Chicago with Classical PKU. I work in healthcare quality at a pediatric hospital in Chicago as a nurse. I'm first and foremost though a wife, a daughter. I love Latin music as a Puerto Rican Italian individual. I love to eat and I love to travel, so I'm really glad to be here in Vancouver and with my husband who's over there recording. So I would like to say that as far as stress goes, normal stress that we all have from regular life. So work, and then of course being compounded by being a health professional during a pandemic. I was actually roped into doing a lot of the work towards new protocols for COVID in a time where we all knew nothing about this crazy thing. And then other regular work, life milestones like getting married. I got married at the end of 2019. We bought our first condo last year. Our basement flooded. So all things that can be very stressful in general, and I know you guys can all relate with regular life stress. And then of course, you can also relate to PKU diet, which as much as you want to put in a different category, it affects everything you put in your mouth every single day. So that's as much as I'm prideful, I didn't want that to be a stressor, but it definitely impacted my everyday life. And then being pulled from all sides, which I know you guys can relate to too, from work, from family, that's just, something that we all deal with. For me, a particular unique stress that I had was I felt like I couldn't escape from the pandemic. Being in healthcare, I know you guys saw the pandemic every day on the news, and then I would go to work, and then I was constantly looking at the numbers and worrying about the patients and the employees and myself. And I was also really scared about spreading COVID to all my loved ones and some of my coworkers. So all of that for me in particular was the perfect storm to kind of throw me over the edge from regular stress to, okay, this is anxiety and I need to do something about this. So can we go to the next slide? So how did I know it was more than that? Because we've all experienced some level of anxiety. I did have anxiety attacks, and for me, what that looked like was chest pressure, kind of persistent for weeks at a time. I might have an anxiety attack in the car if my husband said something that didn't sit right with me. I got really anxious. I had the chest pressure. I had to open the window and I had to lay back in the front seat because I was freaking out, and I didn't know why. I had a lot of physical manifestations of anxiety, so I definitely had some stomach issues. And I would stuff my face to deal with my stress. I mentioned I love food, and I definitely turned to food as a way to cope and comfort myself. And as you know, as someone with PKU, sometimes those comfort foods are not super low in protein. For myself, it's potatoes, and a lot of them, and avocado, which, but honestly, a lot of potatoes. So, and then just tense muscles. I was tense all the time. And so all of that weighed on me very much. And then kind of emotionally, how that impacted me is I did this thing that I called spiraling. And so basically, let's say my boss said something that didn't sit right with me. And then all of a sudden, I'm terrible at my job. And that's like so dramatic. That's not true. And then I'm like, I feel pudgy in my jeans today. And then it would just go down this like really long path of negative things that just totally changed my entire day, my entire mindset, and my outlook, which impacts myself very much and the people around me. And I felt, I actually, at one of the talks on Thursday, this little boy said when his feed was high, and I'm not saying this was the case for me all the time, he felt out of control. And anxiety made me feel that way, maybe my feed levels at certain points. So I knew something was very wrong, especially with these physical manifestations of anxiety, and I had to do something about it. Next slide. Okay, so I'm an adult, right? Let me try to figure out what to do with this anxiety. So I tried a lot of things. I tried breathing and yoga, and as much as they say it works, I was too deep in. I was too anxious, and it was not helping at all. PKU was kind of on the back burner, as I mentioned. I wasn't off diet by any means, but I definitely turned some of those foods that are higher for comfort. Because I was kind of like thinking, okay, well, no, I really need to comfort myself. That's more important right now. So PKU was kind of a little bit not on the forefront like it should be. And then I did actually try virtual therapy. I went out there and I saw a therapist from the internet. To be honest with you guys, it didn't go well for me. She was great at listening, but I'm a proactive adult and I really wanted a approach to therapy that was constructive. I wanted to, how do I get better? Can you tell me what to do? That's why I'm here. She actually ended up crying in a few of my sessions. So she was like really taking what I said to heart. She was very young. We might have been similar in age, or maybe she was younger than me, which I never, broached that subject with her. But she was crying, and I actually had to turn to people in my life and be like, is this normal? Your therapist cry? And I learned that, that wasn't a great situation. So I'm not saying therapy doesn't work. I think therapy is awesome. That particular time, it didn't work for me, and I really needed help. What did work? Running and the Peloton, meditation and journaling. My mind's constantly going, so I had to write it down. And then talking to my mom, she was really good at stopping some of that spiraling. She would notice it, be like, Elena, stop, you're spiraling. Let's move on to a different topic, And however, despite all these things that I did to try to help myself and advocate for myself, I was still having those physical manifestations of anxiety. I still needed help.
That must be the next bullet question. So either use your app or we'd love to hear your stories as well. So during the last 2 years, have you experienced any frequency of it? But we love to also hear last 2 years. Anybody want to share?
Virtual kindergarten returns, small movie, in a new town. Not just there, and that's inside, and that's like. My oldest, my first kid, like entering school, his first time entering school, doing it virtually, in a house he just moved into in a new town. It's a lot.
My first time to presentation. Because you have to take home. Like, so I can get sick.
Very scary times.
So the last 3 years have been very stressful. The learning curve for us is this, and now all of a sudden we're teaching children virtually. I'm a pretty calm person, but things were spiraling is the way I would describe it. And I could feel myself getting into that and no way to get out. We worked it through last year was tough, even that work would seem to be the biggest stress. Working technology as an older person, I did it. So, yeah. fear of getting COVID. Studying COVID. That outbreaks in the classroom this past year. That's not normal teaching. Should be safe over there.
There's one here, one here.
I was gonna say that the last one, being able to go to the gym in the morning, and then you can end up doing some jobs. I guess what's intuitive, but still your job remotely. Then with the stress of being like in your room or in your little office in the house all day long, and then feel like you wake up and then you don't leave the house, and so you go outside or go for a walk. Just being in there all the time. Really, you know, that mentally help the hybrid level of happening in office staff that means so it's kind of
Yeah, I just remember March 12th. My mom's house having birthday party. Last night, all these texts that, okay, school shutting, whoever is shutting, the behavioral clinic is shutting, like, everything's shutting down. And for the first 2 weeks, I was like, okay, we keep to our regular schedule. Don't think that mom will do everything at home. And I remember about 2 weeks, I'm being ready for bed at night, and I must have the opposite of social anxiety. Because I just started sobbing and spiraling. And I was like, what is wrong with me? Because nothing went wrong today. But the thing is, nothing went right. Like, we have to connect with other people. And when internet and technology is kind of a trigger for me, that was really bad.
Absolutely. Thank you guys so much for sharing. I know we're all kind of going through it. And then I think just that, I think you said it, the pandemic just like kind of threw it over the edge. So we can.
Yeah, I do want to point out in the chat that 44% of people said feelings often in the last 2 years. So I don't know if you're a person that feeling that other people are feeling the same as you makes you feel more normal, better off. That's something to sort of take in mind too, that you're not alone. There's plenty of people in the room sharing, plenty of people taking this poll that feel the same. No one said never.
Thank you for keeping us on track with that chat.
Yeah.
Okay, so I left off kind of saying that I tried all these things for myself and nothing worked. And I said, okay. I'll be honest with you, I had help. I had help to reach that decision. My mom was the one who said, you know what, like, what about the PKU clinic? You know, like, you should try to give them a shot. Maybe someone can help you there. My husband was the one who said, you know, you tried all these things. He's a nurse as well. You know, maybe you need help. Maybe you need to look at what other options there are. So I had to kind of listen to the people around me. And I did reach out to my PKU clinic. And as a nurse, I knew it's a multidisciplinary area where I'm going to get the help I need. You know, there's a social worker, there's a dietitian, there's my NP. Someone's going to be able to get me to the end goal that I need, which is to feel better as a human. So that's what I did. I contacted them and they got me in touch with a physician who actually helped me to figure out a microdosing treatment plan for a medication for anxiety. And we'll get into this a little bit later, but I'll just share that something that I need to be reminded of as even as a healthcare professional, that people with PKU have lower levels of serotonin at baseline. So to kind of get to myself to here, I needed a little help. And with microdosing, which I learned all of this, you know, very recently. I started taking the medication in January of this year. I'm really grateful that I took that step and I met with the team and they connected me with someone who's very knowledgeable about medication for anxiety and depression and all that with PKU in particular. So I'll say now that results to date, I feel a lot better, not perfect, it's still a journey. I definitely have less spiraling. It has not gone away, but I'll say that when I feel like I might hit a time of crisis, it's nowhere near where it was before. I feel like I can handle it. It's just a help, you know, it's something I have turned to, and if I, you know, kind of ramp off it, I know that it's an option in the future as well. So with that, you know, I'm a work in progress, and I know we all are, but I just wanted to let you guys know my story.
Yeah, so as you know, Elena, eloquently explained, purposefully, important to have self-reflection. It's left with that. not only for the pandemic, but just in terms of there's so much going on in our life in terms of ideally we want balance, but you know, it's just very stressful environment. So there's certainly activities that one is just that we just with a lot of these. Also, social connections are so important. So nice to be a person again for this topic. So another question we want to ask is what food insight
I'm sure with a lot of anxiety in the last 30 years, I was just going to say, the question I guess they is my is I've kept a journal, almost daily journal for the last 17 or 18 years. And there's just something about not only being able to document it, but when I have stats in the shelf, it just doesn't. Every now and then, I'm back to it's like, it was 2005, you know, and it's really nice to be able to go back and see how much you changed when you're in the middle of just feeling completely hopeless and completely anxious and you write about it. And 15 years later, you go back and
Elena actually mentioned the workouts. That's sublimation. It's like I can't ever control how much negative energy is gonna just pop up. But I can control what I decide to do with it. And I've been doing it since childhood. Long distance workouts of some form. It's like they keep me sane. It's like I still get. There's a source of energy that the source itself isn't something that is real helpful, except that you just know it's always going to be there. Use it.
So it's a shame for people who like to go to the gym, how the more restrictions.
Yeah, but I almost regret that it's exercise. It's like sublimation is that conscious decision that, okay, I may not like this energy, but that doesn't mean it has to go to waste. And in some regards, I feel like a lifelong, distance runner. What could I have done differently with that amount of energy? But I didn't as explicitly understand why I was doing what I was doing when I started it.
It looks like 50% of people from the poll think physical activity.
That was really well put. I'm sorry, go ahead.
I was gonna say, I think I've heard exercise. But again, it's like, I could be just walking slow as a snail and it's helpful, just as I'm moving. If that's what I'm feeling sad, moving slow is what I'm feeling angry, like, I mean, it's good. But I think for me, to add on to that one, it's out nature, outside, like just being in nature. I get migraines, I get chronic pain. So like, I used to be a distance runner. I cannot do that now. Like, it would give me migraine, but to go outside and to move, be out there, it's too painful. Much will give me so much more. And then you go ahead and so
Yeah.
it's it instead of positive, it's like I need to putting that down and be.
Yeah, definitely that TikTok spiral. That you sometimes and you have to put it down.
And sometimes it's good to just check out for the time period, it's not fun, but it happens. Yeah. COVID stats.
So, you know, we definitely have seen so much of the news. And, I don't know if some of you heard Dr. Kimber on Thursday. That's what he said. From,
So I have the boring part to talk about the science behind. Don't worry, I have my emotional support notes behind it. So why is it this way though? Why does PKU have more instances of depression and anxiety than the general population? And is there anything we can do about it? So throughout the last talk, you know that several of us have said now that you don't come to a PKU talk without seeing the pathway. There should be something new and it's exciting about the pathway each time we put it up. So phenylalanine, pH converting to tyrosine. Really, I think that a lot of the key research that I've learned through medical school has really focused on what happens with that lack and that breakdown in that pathway and inability to get that tyrosine into the brain to make their neurotransmitters. What I think is fascinating is a lot more research, as you've probably heard of various parts of this conference, which I like that it's kind of going together, is a lot more too of what else is going on by the sort of neurotoxins, those chemicals building up from the buildup of phenylalanine into the brain, and also not just one being high, one being low, but the imbalance that happens in those aspects. This, I pulled more tables and graphs from some scientific journals because I didn't want to go through some long, boring slides, but more some images and aspects that might be helpful for you to sort of connect with. We all know, we've all been told by physicians, by different expert areas about reading on our own, what untreated PKU looks like and how terribly neurologically devastating this is. The part that really comes to light is how much the neuro sort of psych changes and sort of effect on our neurologic system still happens with treated PKU. If you look at this table, and not to be daunting, so with children and adolescents, early treated, we see people say these symptoms and sort of in this chart that shows that there's the attention problems, the school problems, low self-esteem, decreased autonomy. You see a lot of this that sort of correlates with someone with chronic medical concerns, chronic healthcare issues, but it's more than that. There's some other aspects that someone with chronic illness, yes, they have that lack of autonomy. They don't have the haziness, the fogginess of sitting in algebra when their heat is high. It comes along with that. Even adults, early treated, maintained on treatment. Unfortunately, we do have that aspect. There are plenty of adults, there may be some in this room that were part of the sort of program that you need diet early on and then you get taken off diet in childhood. And now we know diet for life, treatment for life. But there's some of those that weren't on that lost jobs, had nervous breakdowns. Even when they came back from treatment, there was large shifts in probably the neurotransmitters in their brain by taking their formula again, getting back on treatment, that things were shifting and changing, and they still suffer from some significant depression, anxiety. I don't know how many people can relate to things on this chart. You can read it well. Decreased mood, phobias, decreased positive emotions, low self-esteem, and that chronic lack of autonomy. There's some things that happen or do. To go off of that, this was a study done by the group in the UK that really showed the prevalence of mental health related to the phenylalanine level. So what's interesting is the light graph on the top of the bars is those who have a phenylalanine level greater than 600, so above our recommended treatment range. And the black line is those less than 600, which is our recommended treatment range for PKU. Though the part that's really interesting is we see that significant decrease. So treatment does help bring those neuropsych symptoms down of mood swings, anxiety, depression. What's a little bit more striking though is this does not get down to the general public's levels of anxiety and depression. I think this paper is one of the many that have now shown that there continues to be a significant increase in anxiety, depression symptoms for patients with PKU compared to the general population. Question that a lot of us have as medical professionals, researchers, as people living with PKU, well, how do we get it there? How do we get it to be the same? Yeah, I think there's a lot of theories and aspects there, but yeah, that is quite significant even for those low levels. I think the aspects that we're looking into is there some sort of mild neurologic irritation that happens even within the treatment range. We don't have good studies yet of patients who have dropped all the way to the normal range, the less than 2 milligrams per deciliter, what the typical population is. So even though we're bringing the Phe level down to what we recommend as treatment, is that really low enough to decrease that? And not to make your anxiety worse by the presentation. So I'm doing great as a medical professional, being like, so your Phe's going down, your anxiety is going up. That's what I tell them.
Can I ask where, when you say our recommended level of treatment, who's our? Like, there's a paper in the US and it's like 360s.
Yeah, so the American College of Medical Geneticists, the American College of Pediatrics really showed that there was, these are old papers and data now showing that the treatment range is to bring down below 360. That's sort of why too, what we took patients with hyperphe who have that range that is above sort of what's typical for the pH enzyme, but below 360, that we decided then sort of as what we recommend as a treatment range. And that's really that was the level that showed the decrease aspect of severe intellectual disability, seizures, those sort of aspect, also melanin changes. But that's, yeah, to be curious, and I might call on some other medical professionals in this to see how we're going to change that as we sort of advance medicine, because I think that I've seen this theme as a medical student, then a resident, as a fellow, now as an attending, that a lot of the treatment we considered, oh, this is a treatment success, we're here, but still there are many more complications that are still happening in the general population for multiple aspects, not just the neuropsych aspects, that we need to do better and keep moving forward. Does that mean that eventually we come as a medical society, change the guidelines on what the control is? I think that we need a lot more data, different technologies, treatments that do bring the phenylalanine level down to the normal range. Like some of the PayPal patients are now in normal range of diet. There's not enough patients yet to know what is their neuropsych testing over time with that, but I think that that's something that will continue to change. But right now, our current methods that are very widely available aren't realistic too, to be like, okay, we're going to switch from your diet goal of 360 and we're going to make it 120 now. You can have this much protein. That's not realistic. But to be hopeful, there are a lot of new treatments coming out, new goals coming out. I think that's one thing that I love about this field of medicine is we're always advancing and doing better, right? We're never like, this is good enough. We're done, go home, right? We're always going to be doing better, trying to spin it in a positive light. This study, it's tiny font, was published in 2021, but was done, I think, few years before that really put together. These numbers now, and during middle pandemic, we're not post-pandemic yet, but middle pandemic, are probably outrageous. And then this is the slide that you're gonna have a quiz on at the end. So all of these steps, if you meet some of the my teachers, the people I really look up to, Dr. Harvey Levy, Dr. Jerry Berry, they see all of these molecules floating above them at every time. And I'm just like, no, like I need to know tyrosine kind of makes these things. And I'll look it up. And so this just shows some of those neurotransmitters, those chemicals in the brain that we need for normal processing aspects. And tyrosine makes dopamine, norepinephrine, epinephrine. And so one would think, just looking at the slide, that you would have less anxiety concerns from having PKU, because if you have lower tyrosine, you're going to make lower dopamine, but that may mean lower epinephrine and epinephrine. But that's not true. It's all about a balance with the brain too. As Elena spoke earlier, we naturally have PKU patients naturally have lower serotonin levels than the general population. This is because an abnormal balance within the body, and the neurons are going to try to correct themselves. The body is an amazing thing. It's also relatively dumb. That if you have an imbalance, it's going to try to correct itself, even if it's in the incorrect way, that there are side effects to that. So we have to help the body, because we're smarter than making the body now in 2022. So I'm excited to see your scribbles of this later. And this is just taking everything that we said and really putting it onto a graphic that was pulled and plugged from the NPKUA, as this is the conference. And while there's no financial disclosures, there'll be a tip chart in the back and hopefully funding from NPKU in the future to really show that this is not one aspect of the body. It's the entire body working together. And we're hyper-focused on the neurons today in the brain causing sort of the neuropsych issues, but it's multiple aspects of the body causing these symptoms. Because if you have neurologic irritation in the brain, you're going to have neurologic irritation elsewhere too. You can also think of this many times. Many patients will say that maybe their brain's a little foggy, but also the GI symptoms, maybe you have felt before. That's probably some aspect too of the neurologic imbalance there. And we'll go into why the medications might have a little bit more side effects. So that was a lot. Any thoughts, questions, concerns? Complaints are not accepted.
So these techniques are from, have you heard of Dr. Lori Sanders? She's a psychologist at Yale. Her class, The Science of Well-Being. It has a lot of different. So, you know, Josh, you're a little bit of a booker.
Yeah.
But in terms of their, you know, like Elena, how she was describing her anxiety, you know, she was able to overcome that. Strategies, medications we can talk about. So also it's so important to cultivate, you know, life structures are going to come at us. What is it we do? What are some things? Anybody want to talk about it? Anybody try to come to be the group? So so it's used for anxiety or depression. She was in the height of her anxiety. So like there go to these automatic thoughts. Therapy, nursing. And concept about, you know, that's really realistic. stressors?
So the therapist that I see, we never come out with small things. My case, it's all about because the first person some confidentiality issues, professional things that were just not done right. So somebody violates that trust. That's when you're going to someone in a very much violate access to trust. I can see like it's something control, but finding someone who truly understood, who also happened to come from the first responders who have worked out the world, good things, and finding somebody else who works in that world and sees it, that kind of helps. I mean, it'd be frustrating trying to find someone, but being on the back end of that, finding someone who would be really effective, really well.
Yeah, well, that's really great. Actually, that's one of my dreams. It might take a little time, but to actually have an advisory board of psychosocial professionals. You can just explain it, you know.
I was thinking because there's like the scientific side of you know, on these charts and stuff, but also there's the the aspect of the like T trauma, having a metabolic disorder, and you know this year like it was like again it was really hard to get this NORD got this coverage, and then after that it was like formula shortage. I mean, just like these added traumas because of having but where someone that would get that, you know, would be really great. Like if there was someone at your clinic, so you could talk about that and you know get the whole picture.
Yeah, no, I think that's a good point that we try to compartmentalize and say, oh, PKU is 5% of our lives. But if you have to explain to your medical professional over and over again what it's like, that
And
makes
you
it
just
very
dismiss
hard.
it or to think everything is this.
Yeah.
Either dismiss it like you saw, no, that's not the PKU. Where it's like that's only because you need a little.
Yeah.
Half the time by the end of the pregnant, I was like, can I go you now?
Yeah.
Because I just taught you everything.
Yeah.
What
No.
advice do you have for me?
Yeah.
That's what I came for.
Yeah.
I'm so like a lot.
Especially when it's not cheap to go to a mental health provider. There's a lot of issues there that you do not want to be spending your time, your precious dollars per minute that you're spending for that to teach.
I also love the panel this morning. They talked about, you know, also the cosmetics.
So while the title of the slide is called Helpful Medications, unfortunately, this may be a super unhelpful slide with medications because there needs to be a lot more research into the medication aspect in treatment of PKU. We know some medications traditionally work better, such as SSRIs versus something like MAOI inhibitors tend to be more poor. These are just classes of antidepressants. And sort of both treatment sort of arms sort of target the anxiety and depression at the same time is really what we're sort of looking for when we go for standard depression anxiety. Again, going back to the healthcare professional that you may be seeing from your mental health may not be the same person that knows much, if anything at all, about PKU. So you might have to educate them or ask them to contact somebody with that knowledge of PKU and those aspects, especially as we get more trials and more sort of understanding of which medications may be less impactful. A big area that we were looking at too, preparing for this talk, is the side effects for antidepressants seem to be much higher for patients with PKU than the general population. And the question goes back to sort of those neurologic aspects and the imbalance. Is disrupting that imbalance causing a bigger side effect profile and causing those sort of changes, especially the GI upset, anything that's sort of aspect of those or the mood swings. And a really hot topic too is, and a hard one, is those aspects of bringing up thoughts of anxiety or suicide, ideation. if you take one of these medications. We know that's a risk for the general population and higher concern for the PKU population. So I think what's interesting is the idea of microdosing that's came out is taking smaller doses than you would need for the general population. I think I've heard that from several patients for other medications as well as I need just a little bit of medication and that is enough for me. That's not I don't need the dose that you would need for a standard patient.
So how much of a micro are we talking? How do you get it from the
I can
Yeah,
I
would
can
you
share
speak to what?
personally, yeah, so I don't, you can maybe ask me offline if you want to know like specific medication, but truly that's gonna be up to your medical team. I'm not gonna prescribe you anything, but just for the medication that I'm taking, don't quote me, but I think the minimum kind of therapeutic dose is 50 milligrams. And so not only am I taking a smaller dose, but they started me really tiny, so I did half a pill at 12.5 milligrams. And I'm currently taking 25 milligrams. So with the smallest dose typically being 50 milligrams, it's a microdose and I did it super slowly. And it has worked out so far for myself.
While not saying what medication she was on, I will say as a medical professional, I have started a 6-year-old on 25 milligrams a day. So
What
listen,
medication?
sorry.
A 6-year-old without PKU.
Yeah, 6-year-old without PKU. We have, so we can offline if you want to say we're not supposed to say for the broadcaster at that aspect. So sorry about that, but just to sort of illustrate that we took the pediatric dose, took a step back. Even again, this is something that was done with the help of the builder, sort of those sort of recommendations. So don't try this at home on your own. See, use a medical professional, but also something that needs a lot more research. So this is a lot more anecdotal evidence thus far. It needs a lot more sort of true clinical research.
So how many research papers are we talking about that have actually put information out there? I can't imagine the studies getting large enough to.
I think the problem too within our field though is we don't need a large number of patients participating. We just need what has been done out there and published. This happens, I think, again and again in metabolism and unfortunately in PKU, that you will meet someone who's an expert as a junior faculty member coming into the world. You meet some of the genebrities out here, the genetic celebrities that are at this conference and talk to them and they're like, oh yeah, we've known that for 50 years and well, we need to publish it, we need to write it down and we need to take what's been done even with an N of 1 and publish it and share that. That's my thoughts.
I think I agree with you.
Good.
Turn around and ask all of us.
Yes. I think that's the hard part. It's so great that you are all experts on your condition, but it's really hard for a medical person to just call you up and be like, hey, I'm in clinic. What is going on?
Yeah, so the importance of building your own personal PKU. We all have strengths and resilience. What unique things. Also, anxiety, manageable anxiety. So, what are some things?
So we spoke a lot talking about what's wrong, hearing Elena's journey, how she helped build her toolbox. I told you all the things that could possibly go wrong and more. And now it's really sort of, we're hoping you sort of take the toolbox you already came with and put a few more tools in there.
Connecting with the higher power. Like thinking about life, like what happened. What's happening next is super important to be like, this is something I struggle with. But there's probably a bigger.
Thursday is that, so I'm gonna kind of refer to Dr. Kendra's talk from Thursday. She kind of laid out how you can kind of prepare yourself for this so it doesn't get to where I got, which is a crisis mode. So I would imagine that for you is in your wellness toolkit. Again, this is what Dr. Kendra just said. I'm not making this up. And then you, of course, I'm taking this exactly from her talk. There's a daily maintenance. So for me, maybe that's the journal triggers. You know, we all kind of figure out what those are for us, so we don't get to that crisis mode. We are triggered. We could refer back to our wellness toolkit to get us back to where we need to be. Again, all from Dr. Kendra.
Yeah, I think that's really important to sort of think of what do we do on daily lives and what is in the big toolbox in the garage, because you need both.
So you have like competitive versus something now actually.
Yes, so it's.
To be honest, I'm still figuring that out. Obviously, what I just laid out for you is a very structured rating character mental health PKU, and I just learned it on Thursday. I would say, I guess, just hearing you, the journaling would be, you know, part of my wellness toolkit. I think I'm still figuring a lot of that out. And it sounds like for you too, the journal. Yeah.
It doesn't have to be permanent. It's for a while one tool's working, but then it's not. Go get a different one.
Yes, I'm just a observer. I've seen my plants, and I feel like that's been a very therapeutic thing for you to keep something alive now for about a year. And it's victories within that too. That's just my observation.
So I'm a plant mom, yeah. As I see, we grow plants in the house, and I guess that seems to be therapeutic.
Personally, so I
And practice those things. Don't go toolkit first time when it's an emergency. It may not work. You want to practice these things.
It wouldn't be a talk about this unless we talked about the little things. I've always been, but I've become even more of a routine person as I figured out what works for me. You know, most recently I got a creamer from Aldi that I'm obsessed with, and part of my morning routine, along with like working out sometimes, and you know, journaling sometimes, is just literally drinking that coffee for 10 minutes in the corner on a chair. And just in my podcasts, and just making time for those, making them a priority, and making them a part of my everyday routine. It's just, you know, finding joy where you can. You know.
We're millennials, you have to treat yourself.
Yeah.
Even if you deny yourself anything, treat yourself.
Is it a Starbucks cup?
It's so true though.
So that's all we have. What other questions do you guys have for us, or is there anything that's happening?
There's nothing in the chat. Is there anyone that wants to put anything in the chat? I feel like we ignored the online.
Go ahead.
I do have a question. So one of the things you like to do is I'm curious.
Yeah.
So one of the things that, you know, obviously it was a skewness of people who are above 600 milligrams but they get pregnant with study. So I'm wondering, do you guys know any additional research on like for versus not, because they included 17 in that study, 9 of which were relatively stable and 8 of which I'm wondering, does that skew the data?
Yeah, I think that's honestly in limitations, it probably does, because I've never been pregnant, but pregnancy has its own aspects of anxiety aspects to it. PKU pregnancy is a whole different field, but that's another talk, another chapter that I do think that probably skews some of the data, but I think that that's the cleanest I've seen the data in a nice bar chart, but I've seen multiple studies where we do see that the higher that P level, the higher neurocognitive aspects you see, and just hearing you all talk, say, when my P level is 10, I've got that fog.
That's on its time. PKU pregnancies. I feel like it, like, will at least, yeah, right, but there is more stress, like there is more symptoms, but like it can go away. So my levels are
Toolbox for people that it was like from the behavioral strategies to talk about relaxation. And I don't remember where I learned it, but every morning for 2 or 3 minutes it was like a power pose, where like the lights are all off and just stand there, kind of like almost like a linebacker, your shoulders apart, you know, and you just focus on things that went right the day before, and focus on things that you're trying to accomplish that day, and just try to pull like some positive things to start your day. You know, a lot of us don't have 20 minutes for a PMR session, but most of us have 2 or 3 minutes, especially if you're putting our phones down. You can free up 2 to 3 minutes pretty easily and just kind of start your day and make it positive.
Well, thank you for attending. Hopefully I wasn't too daunting. I hope you liked Sue's session, but hopefully this shows you're really not alone. There's continued research that needs to be done and is being done to improve this, improve therapies, and really hopefully you've got a little bit of something you can take home and use. Sue?
Where is research being done specifically on like medications and or is it kind of just open research, like the clinic or?
I think it's various sort of clinical aspects. I know I was did my training at Boston Children's Hospital with Susan Weisbrand doing some of those sort of aspects too. That Bill still is. I know Ben, I forget Ben's last name. Good is still at Boston Children's, and he's doing different sort of aspects of that too.
And not many from this meeting to meet with my hand.
Yeah, we would love to see the aspect of NPKU that's focused. So put a plug in for what we're passionate about. Have a quote from us.
So that's by journalist and writer Carol. No matter how bleak or menacing the situation may appear, it does not entirely us. We can't take away our freedom to respond to our own.
Thank you, everyone.